Leaders across Africa have made bold commitments to reaching malaria elimination within a generation, which is a vision that everybody wants to support. But such commitment does not only require political will, but it also requires enough investments, because we know that those policies are meaningless if we do not talk about money matters.
We need all the concerned members of the society to hold the government into account by asking pertinent questions such as, where is the money for malaria? And can our government increase investment given that donor funding is decreasing? Because without local funding, these programs cannot be sustained.
That is why our team at the Center for Economic Governance and Accountability in Africa, CEGAA, has collaborated with the University of California, San Francisco's Malaria Elimination Initiative to develop an online training series of videos that provide the foundation for budget monitoring, expenditure tracking, and budget advocacy, the so-called BMET approach.
The BMET approach has been tried and tested in East, West, and Southern African regions or other disease areas, and is now being used for malaria. And we know that this approach works because it's used to build the evidence that different stakeholders need to mobilize for more resources at national and subnational levels. And without these resources, malaria elimination will just be a dream.
This series will help malaria program and finance managers, as well as those who are involved in implementation, and health advocates, starting from the district level up to national levels, to understand how the budget is formulated by looking at the public sector health budget process and develop their own performance-based budgets. But more importantly, how they can influence decision makers of the allocations that are made.
For me, the CEGAA training was great. It allowed me to understand the bigger picture of the budgeting process and how me as a media practitioner can actually fit in terms of the messaging, how to construct or compile our messages accordingly. And in terms of budget advocacy, how we can advocate for our priorities to be considered.
I learned approaches on how to advocate for malaria. In malaria elimination, without finances, there's nothing that we can do. So we were taught how to prioritize. We were taught how to negotiate, which made it easier for me as a provincial director to advocate for political will.